Já bych se vás zeptal, jaká byla úroveň vašeho vidění před tou operací? V čem vás to omezovalo? Jak jste viděla, co jste dokázala třeba číst, jaké jste k tomu potřebovala pomůcky a tak, jak to bylo s tím viděním?
No, začalo to tak, že jsem si šla pro brýle na oční, že špatně vidím, slabě. No a paní doktorka mě zjistila nebo mě oznámila, že mě nedá brýle, protože mám špatnou sítnici, která mě slábne.
Before the surgery, visual tests with an external telescope were performed. It is necessary that vision with the telescope would be at least 2 lines better than the other eye, and the telescope would improve vision by at least 5 letters. Our patient met the criteria for implantation of an intraocular telescope. The miniaturized intraocular telescope produced by the American company Samsara Vision has a glass optic filled with air, so that a light telescope weighing just 120 milligrams in the air is even lighter in the intraocular fluid. 3 silicone haptics stabilize it in the lens bag, and the optics magnify the image 2.7 times. On the left, we see an image of the eye with a natural lens, where a scotoma overlaps most of the face and the patient does not recognize the person. On the right, we can see the image after the implantation of the intraocular telescope, where, thanks to almost 3-fold image enlargement, the scotoma overlaps only a small part of the face, which has become recognizable to the patient, but at the cost of reducing the field of vision. Our patient underwent the first implantation of a miniaturized telescope in the Czech Republic. Capsulotomy with capsule laser allows the best centering of the telescope's complex and long optics. Centration is performed according to a dark target created by trypan blue on the anterior capsule. We're centering the capsulotomy on this target. We discovered this method at our clinic. Circular capsulotomy of 5.5 millimeters diameter is exactly what we need for the telescope optics. We cut the conjunctiva and perform a 2.2 millimeter sclerocorneal incision. We aspirate the cortex while the blue capsulotomy edge is perfectly visible. Now we enlarge the incision to 7 millimeters. The miniaturized telescope is supplied in a container which we fill with visco material. The container connects to the injector. We unlock the container and insert the telescope into the injector. We unlock the injector and remove it from the container. And now, we're ready to implant the telescope. After inserting the injector into the incision, the injector tip reaches the capsulotomy level and the telescope is inserted into the capsular bag. The telescope was beautifully centered. We suture the incision with a double cross stitch, which we tighten gently for as little astigmatism as possible. This is followed by a conjunctival suture with a submerged knot. We inject triamcinolone, cefuroxime, and anti-VEGF transzonulary into the vitreous. The operation ends with incision hydration.
Takže přátelé poznáte, podepíšete se, 8směrku můžete po 4 letech vyplňovat. Co ještě? Na televizi vidíte trošku?
Na televizi s brýlema.
A jde to.
Jde
A
to.
předtím to bylo bídné, nebo?
Předtím jsem neviděla vůbec obličeje, nepoznala jsem, o co se jedná.
Jo.
Získala jsem tím hodně. Opravdu jsem říkala, poznám lidi, poznám i detaily. Viděla jsem poprvé pravnučku, která se narodila před 2 měsícama.
No.
Tak jsem byla z toho úplně nadšená, jo. Doporučuju, opravdu doporučuju všem,
To je
mají
fajn
tenhle
s
problém.
pravnučkou, jo. Tak dobře, tak já mám z toho radost a dobrý pocit, myslím si, že jsme pro vás něco fajn udělali a že na nás budete v dobrém vzpomínat.
Budu. To
Mějte
si
se
buďte
pěkně,
jistí.
užívejte
Vy taky.
vnuku, pravnuku
Děkuju.
a občas přijďte na
Děkuju
kontrolu
a vám
ještě,
se,
jo?
ať se vám daří.
The patient's distance visual acuity improved by 4 lines from 0.2 to 0.6, and she reads Jaeger number 10 uncorrected. Here are the basic indications. Visual acuity of both eyes from 1:30 to 0.25. The difference between the two eyes is less than 5 lines. Peripheral vision of both eyes is preserved for orientation. Inactive macular degeneration, dry or phase even as a disciform scar, and the better eye into which the telescope will be implanted must be phakic. The operation is demanding for the surgeon and the patient alike. The main challenge is adaptation to the enlarged image with restricted visual field. Please note, we implant into the patient's better eye, which poses a risk, but it is the only option for the indicated patients for improving their vision. Now we have the opportunity to implant as part of a clinical trial for free. Not every patient will be as successful as our first patient. The first experience on 3 patients in the Czech Republic have been very positive.